The future of healthcare is here, and it has changed the whole approach to medicine. Well, if conventional wisdom mandated that prevention is better than cure, the new buzzword is prediction. How healthy will you be in the next few years of your life? Would you not want to know that? In healthcare, AI-powered technologies are getting as real as possible, cutting close to the bone with predictions on your body that are as solidly reliable as possible. Are you in line to get cancer? How much of a risk are you at for a heart attack or a cerebral stroke? And most importantly, when? At what stage will you see an onset of metabolic disorders with its spiral of diseases, causing conditions like diabetes and blood pressure? How much time before your arteries start choking like a traffic jam in your city? Do you have a strong predisposition for glaucoma-induced blindness? Does any form of dementia lurk around in your sunset years? What about arthritis? Medical science powered by AI, which is artificial intelligence, is answering these questions for you now. We're going to be telling you how exactly up ahead on the show, because this is the future that really matters to you, that of your body. I'm Sneha Mordani. This is Health 360, and this week we are collaborating with the India Today magazine. Artificial powered diagnostics is changing the landscape of healthcare in India, with a new emphasis on disease prediction and lifestyle interventions rather than post-facto cure. What if someone could tell you sufficiently in advance what disease you're likely to get in the future, and you act on it so that possibility does not come to pass at all? What really is predictive healthcare, and what is the size of the market? How does predictive analysis work? What is the AI advantage, and what are the challenges?
We have all had health checkups. Our sugar levels, our thyroid tests, our hemoglobin levels, and everything else that your complete healthcare package can offer. But can these routine tests predict if you are going to develop dementia in your sunset years or have cancer at some point in time? Will you face hearing and sight challenges when you grow older? Or are you prone to developing arthritis? They cannot. Predictive health diagnostics powered by AI will do just that. Predictive analytics in healthcare entails the use of data to assess the possibility of disease before it has actually set in. It can be used for healthy adults who, if found predisposed to a particular disease, can, with the help of lifestyle or medical interventions, avert it altogether.
The scope of AI diagnostics is actually phenomenal. The way it has and the way it will revolutionize healthcare is going to be something that will be very exciting for all of us to witness in the years to come. From a diagnostics perspective, AI has already in the past many years automated a lot of steps in the diagnostic chain that were actually manual earlier. This leads to a higher throughput, so that means more samples can be processed at the same time. It also leads to more accuracy, more precision, that is reproducibility, and at the end of the day, more reliability on the results. So essentially, AI will not be replacing the doctor, but it will be the doctor's assistant that will help the doctor and augment the doctor to make a better diagnosis and adding more value to the entire chain of care continuum of any patient who visits a healthcare facility.
In predictive healthcare, we use multiple factors, such as patient's environment, genetics, and some blood parameters to see if he or she is at a higher risk for a non-communicable disease, and come up with a personalized preventive plan.
It
works on the available data. So if the data is voluminous and obviously with the coronary artery disease and lifestyle related diseases, even in the case of cancer, we have voluminous data available, So it can analyze the data which is available and the risk factors that the patient has. Say for example, a patient who is 45 years of age, he has got strong family history, like his father or mother has a heart disease, existing heart disease. Also, if they have got diabetes, and the patient has got high lipid levels, his lifestyle is mostly sedentary. So all these risk factors can be analyzed, and they can be analyzed by the artificial intelligence.
CT scan data to help predict early lung cancers, COPD, and interstitial lung disease.
It is being used a lot, not only in diagnostics but also in treatment. Like our mechanical ventilator which we use in ICU, they work on algorithms. Non-invasive ventilator which we use in management of many diseases in pulmonary medicine mainly, they are AI based, they work on algorithm. Then our pulmonary function testing which tells about lung capacity, they work on algorithms and work on AI. So definitely with more robust backend data, with better diagnostics and better algorithms, we have a lot of place for AI in medical diagnostics.
Rehabilitation is such an important and integral part of cardiac, surgical and heart-lung transplant programs. And also in neuro programs, where the patients recuperate after stroke, they've got varying kinds of disabilities, And we see in our cardiac, surgical and transplant patients, these patients have got gait abnormalities, they've got muscles which are weak. Artificial intelligence is a new tool that has sort of reinvented how we give physiotherapy to all our debilitated patients, especially it helps in planning out what kind of treatment should be given to the patients.
Powering this predictive healthcare revolution is artificial intelligence, which has already permeated many aspects of human life and has come to healthcare too. AI, along with the Internet of Things, machine learning and other cutting-edge tech has now spawned what is called the IOMT, or the Internet of Medical Things. AI produces algorithms out of vast amounts of data that help in precise and speedier diagnosis and treatment.
AI would be the one thing which will be going to do wonders, because lot many people are scared. When I talk about the people in age of 30 to 50, they are more worried than elders nowadays, because they really don't know why one of the colleague who was sitting along with them, why he got died. So that is the thing. If they'll get a thorough assessment of theirs backed by data, then they will at least give respect to their health. In previous era, we used to see heart attacks after 50s. Now 21 years, 28 years, to an extent because of the bad quality of life, too much of junk, bad food habits, a lot of alcohol and smoking. So that is giving bad health. So yes, this would be a one-stop shop. AI would really change the world.
Dr. Rai Siktupal on this kind of diagnostics picking up pace and on takers for it, since AI-based predictive analysis is most useful in the field of diagnostics. The growth in that industry is indicative of where India is headed, even though the numbers may appear modest at the moment. A 2023 report on AI in diagnostics in India by market analysis firm Insights 10 has projected its growth from $0.02 billion in 2022 to $0.24 billion by 2030. While early diagnosis, better treatment outcomes are the positives of AI in diagnostics, the challenges of AI are false negatives and limited data set.
For any diagnostic test, there are two most important things. One is the clear image which we get. Second is how accurately we can detect the abnormalities or problem. So we are using ultra low dose CT scans where we are using less than 97% of the radiation which are normally used in any CT scan machine, and we are enhancing the image by using AI. And once we do that, then in a very clear image we are able to detect abnormalities by using AI, and we report it to doctor that how exactly is the problem, and then doctor can suggest that what kind of treatment should be given. That's how it works.
The positive side of AI diagnosis are better treatment outcome, whereas the challenges related to it are false negatives and a limited set of data. For now, there are some challenges related to AI diagnosis, but let's accept it. AI is the future and we should be ready for it. With camera person Sachin Chandok, Ishwara Radhakrishnan for India Today.
A whole range of lifestyle and genetic diseases that can be predicted. Let's take a look. Heart disease predicted using data on age, sex, blood pressure, cholesterol, along with family history and lifestyle risks such as smoking and obesity. Depression and Alzheimer's. Depression is predicted using blood reports and genetic tests. Alzheimer's is predicted using MRI scans and genetic tests. Eye disease predicted using retina scans, blood markers and genetic scans. Liver disease predicted using genetics, also blood reports and CT scans. Recurrent pregnancy loss predicted using genetic scans. Autoimmune disease predicted through genetic tests. Common cancers predicted using blood markers, genes and high imaging radiation machines that can detect small growths. Diabetes predicted using lifestyle parameters, family history, body fat percentage, baseline glucose and HbA1c test. Rare diabetes, about 2 to 5% patients of type 2 diabetes in India have MODY, a maturity onset diabetes of the young, diagnosed only through genetic tests. So how does predictive healthcare work? Pre-screening is the key here. A patient is assessed on family history and lifestyle. Various blood scans, tests ascertains the clinical condition. Some may use AI machines to detect abnormalities. Genetic testing also, blood tested for genetic markers associated with the disease. And then machines use algorithms to compare the test results with data set to predict disease's risk. Intervention, doctors suggest lifestyle changes, medicines to reverse the disease. Here are the advantages of artificial intelligence in diagnosis. Early diagnosis, for example. Any prediction of a disease risk prompts increasing in monitoring, leading to early diagnosis. Better treatment outcomes. An early diagnosis in turn leads to improved chances of treatment success. Less reliance on medication. Doctors recommend lifestyle changes instead of medications. Avoiding surgeries. Timely lifestyle changes can prevent severe complications, avoiding the chances of surgeries. What about the challenges related to artificial intelligence? False negatives. A negative result does not guarantee that the person won't get the disease. Limited data set. For AI machines to make accurate predictions, a very large set of data is required to compare against the results. Quality of diagnostics. The analytics depends on blood markers, body scans and genetic markers. If these are not really up to the mark or quality, the prediction will not be accurate. So how does AI diagnostics really work? Which are the machines that are being used to predict how well you're really going to be? Now, India today visited some of these labs across the country that are predicting how well you will be in the near future. They are doing these scans and these tests, studying data, and data analytics really is at the heart of predictive analysis. Take a look at this report.
Data and data analytics is at the heart of predictive health, and the diagnostic industry has picked up pace. India today has tried to get a sense from labs that have already made a foray in this. There are so many diseases now which are very common in India, and AI can save lives if detected at an early stage. The topmost is cancer. Breast cancer is one of the most common types of cancer in women and is highly treatable if detected early. The survival rate is 99% if it's found early and treated.
Many women have history of breast cancer or cervical cancer in the family, and that is the reason that this test AI mammography is done. It gives you an indication of your chances of developing cancer in future. You can treat it if detected or diagnosed at an early stage.
Noora Lab has introduced AI mammograms or AI supported mammography analysis, which is the best way to see a patient's susceptibility to breast cancer even before symptoms appear. Mammography is the process of using low dose radiation specifically to see the image of the breast tissues and assess breast health. Each breast is examined separately and compressed against the digital detector film to obtain the best quality image for assessment.
Very rightly you said that this is a very important thing for any woman to go for this kind of test. But there are two factors. One is in a normal mammography, it's a little bit painless. It's a little bit painful for any woman to get that test done. But the technology, the machine which we are using, it's almost painless. And then with our AI based technology, we are able to detect any abnormalities 2 years before it can be done by a normal scan. And we are using 3D digital mammography, which is a very advanced technology. So we always encourage that since it is a almost painless process and it can help any woman to get rid of these diseases at the early stage. So I agree, this is very important and we should try to increase awareness amongst women as much as possible.
AI experts say that they can revolutionize diagnosis and breast cancer treatment. Researchers also found that AI-supported screening resulted in cancer detection rate of 6 per 1,000 screened women compared to 5 per 1,000 for standard double reading without AI. Cervical cancer develops in a woman's cervix, that's the entrance to the uterus from the vagina. Almost all cervical cancer cases, that's 99% of them, are linked to infection with high-risk human papillomaviruses or HPV, an extremely common virus transmitted through sexual contact. It can be easily prevented as it has a long precancerous phase which can be detected if women screen themselves regularly. Screening for cervical cancer using colposcopy. During a colposcopy, the doctor closely studies the cervix with a colposcope, a special magnifying instrument with a bright light that allows for quick and accurate diagnosis. AI-based dual fluorescent colposcope, which uses blue light in addition to regular light, increases visibility and accurately identifies early stages of cancer. This is a highly sensitive screening tool. The AI-powered machine for its early analysis for leukemia is AI 100, the flagship product of susceptible, an Indian firm that builds AI-powered software to analyze medical imaging data.
Our first product, it's called AI 100 with Shonit. AI 100 is the digital microscope, automated digital microscope, which is also AI driven. And Shonit is the AI driven analyzer for blood smears. These blood smears are reviewed to detect various kind of disorders like blood cancers, different types of infections, anemias, and so on and so forth. So the Shonit actually automatically detects the different types of cells in blood, the white blood cells, red blood cells, platelets, and categorizes them into different classes and subclasses, normal and abnormal, and presents that result to the pathologist for review remotely.
The Delhi headquartered Dr. Dang Lab is mastering allergy diagnostics. They've introduced Allergenius DX, an advanced molecular allergy diagnostics test utilizing cutting-edge microarray technology and nanoparticles. Priced at about 25,000 rupees, this test can accurately detect potential allergies to 163 common allergens and analyze 300 components of various allergens. With the introduction of Allergenius DX powered by AI.
Over time, allergies have become more common in people. So now to tackle this chronic disease that a lot of people have, we came up with Allergenius DX, or in other words, the genius of allergies detection. How this test functions and how it's revolutionized the entire allergy diagnostics domain is actually very interesting. So till date, in our country, how an allergy was diagnosed by a blood test was that there were whole allergens. So for example, people used to give their blood that used to be analyzed for, say, a food allergen like a milk or a gluten or a soya or a peanut. But what Allergenous DX does is that it divides these allergens into various components. Now, when you assess and analyze one's allergies to a particular component, that gives a wealth of data that, with the AI algorithm that we have, analyzes that data and gives us a conclusive answer on how to actually avoid exposure to that particular allergen, and also, more importantly, how to enter the vast field and very interesting field of precision medicine.
Predictive analytics basically works on historical data, comparing a patient's test results with an entire database of similar reports, research, and parameters.
To identify the exact triggers, this Allergenous DX test requires a few drops of your blood sample that can be given at any time in the day. You don't even have to be fasting for the particular test. We take that small amount of blood and then we assess it and diagnose various components of these triggers or allergens, and then give a precise information about how that protein is going to react to the particular patient if they are brought into contact with that particular protein or component. Also, it's very interesting to know the wide variety of information that we can generate based on the AI that we have inside this machine, that tells you in detail about each and every component and the various reactions, and also the medication and the treatment that would be effective against the same.
Because of the reliance on data, there are data privacy concerns too.
So there are broadly 4 points that I would say when it comes to patient privacy and how to actually uphold them. The first one would be de-identify the data. So that means, suppose we're using a patient's data after we get their consent, it has to be omitted, or the unique identifiers have to be omitted. So the name, the gender, other details of the patient, all these should not be visible in the data that is fed in. The second one would be to encrypt the data. So encryption basically means that you scramble the data in a way that it becomes a code that only particular users can actually interpret. The next one would again be transparency. So your privacy policy for patients should be very transparent. It should show the patient exactly the data that you're using and how you use it. And the next and the most important is that the data belongs to the patients. So patient control. Patients should be able to edit the data, should also be allowed to delete the data at a later point of time that they would want.
While one cannot go back in time to prevent the onset of diseases, thanks to AI predictive diagnostics, now one can predict the future and take steps before it's too late. With camera person Sachin Chandak, Sabai Kram for India Today.